Welcome to our Tri-County Regional Black Chamber of Commerce Let's Talk Business podcast. It is May the 28th, 2021. We are already in May, and not only are we in May, we're at the end of May.
Yes. We are.
Wow. Wow.
Yeah.
So our podcast today is all about health. I'm your host, Howard Johnson, and this is the other host, Miss Leandria
I'm the
Thompson.
other host.
You don't like to come down here. Let's keep it real.
Okay, you're right. Okay.
But
Today was a special day.
very special day, very special day. Leading up to today, the whole month of May, we were sponsored by the University of Texas MD Anderson Cancer Center. So, we want to thank them for sponsoring the entire month of May. And actually, today, on our podcast about your health, we're joined this morning by Dr. Miguel Rodriguez and Community Relations Manager,
Jeanette Lastrap.
Exactly.
Okay.
And they're from the University of Texas MD Anderson Cancer Center. So, we're going to get into conversation and dialogue with them. And back to the sponsors. If you want to sponsor our podcast, please reach out to us. 832-875-3977. 832-875-3977. So let's get right into it.
May has been an entire month of us giving out information leading up to today,
Yes.
letting our listeners know that we will be talking about something that's very, very necessary for business owners and their families. So when we say let's talk business, we enter in all categories of let's talk business, and health is definitely one of them. In order for you to grow business and be successful,
Gotta be around.
you have to be healthy, and you have to be aware of certain issues that come about to where your health is going to be very important, and the people, your family members, as well as the members that the people that work for you. So it's very important that we consider health being a component of doing business. And of
Exactly.
course, University of Texas MD Anderson Cancer Center is in the business of
Health.
cancer. Okay.
Health and cancer.
All right.
Yes.
So yeah, we're joined today by Dr. Rodriguez, and as you mentioned, as well as the Community Relations Manager. I'm doing like you now.
Jeanette Lastrap. I got it this time.
Okay. All right. So let's take it away, Howard.
We're gonna bring Dr. Rodriguez on now, and Ms. Jeanette, we're gonna bring her on as well. I'm gonna just call you Ms. Jeanette if that's okay.
That's fine.
All right, perfect. So thank you guys first off for being with us this morning, and thank you for helping us disseminate valuable information to our business owners and their families. Just so they can be aware of when it comes to health, they have an awareness, they have the information to make cognitive decisions based on their health. So, again, I'd like to thank you guys for being with us, Dr. Rodriguez. Dr. Rodriguez, could you please tell us about the work that you do?
Yeah. First of all, it's my pleasure to be here with you guys.
Thank you.
Looking forward for a great discussion and having some fun with you. And with our listeners. I am a colorectal surgeon here at MD Anderson. Basically, we treat colon and rectal cancer. That's all we do. I've been here at the MD Anderson I'm finishing my 20th year now at MD Anderson. Since 2001.
Okay. Hey, Miss Jeanette,
Yes.
it's your turn now.
Hi, everyone. I want to say thank you for having us on as well.
You're
Happy
welcome.
Friday. My name is Jeanette Lastrap, and I am a Community Relations Manager at MD Anderson, and I lead a team of health educators, and we go out and do cancer prevention presentations in the community. And I'll talk a little bit more about that later.
Okay. Okay. Perfect. Well, I have a bunch of questions, so I'm very big on research. When somebody puts something in front of me and I'm going to be talking about it on podcasts, I definitely want to look into it and see what it's about. And then for our listeners, I guess I kind of want to ask a few questions to, like I say, we're disseminating information, but we also want to disambiguate it. We want them to be able to understand it. So I guess my first question, and anybody can answer it, Ms. Jeanette or Dr. Rodriguez. What is cancer?
Well, cancer basically it's an abnormal growth of cells in different organs,
Mm-hmm.
organ specific. When it's called primary cancer, it's organ specific. When it spreads, it's metastasis, goes
Okay.
to secondary. However, so it's an abnormal growth of cells that can invade into the organ and then spread to other organs. That's in general what cancer is.
Okay. And then I guess my next question is like, how does that happen? How does cancer happen, or how does cancer come about?
Well, it is multifactorial. There's a lot of factors that are involved in the cancer progression, but basically what happens at the level of the cell, it's that there's a lot of changes in the building blocks that we have in the DNA. There are mutations that occur, and those mutations lead to deregulated or abnormal cell growth.
Okay.
And that's what happens with cancer.
Okay. Perfect. Well, we're talking about a specific screening today, and it's the colorectal screening. So, what is colorectal cancer?
Well, as I said before, colorectal cancer, it's the primary organ is the colon and rectum. So that's primary. It is cancer that occurs in the colon or in the rectum.
Okay.
And the colon is basically the large part of the large, but it's also called the colon and rectum is also known as the large bowel. And the colon itself, it's about 5 feet in total, and the rectum is the last 6 inches of the large bowel.
Okay. Okay.
Okay.
And then
Who does it affect?
who does it affect? Who does the colorectal cancer affect?
Well, colorectal cancer does not discriminate. It affects both men and women. And it's really important that everyone is aware of this, because colorectal cancer in the United States and worldwide is the third most common cancer and the second most common cause of death from cancer. So, for example, in the United States, it has been estimated that the incidence of colorectal cancer is for 2021 is approximately 152,000 new cases with
Wow.
approximately 52,000 deaths.
You said 152?
Yes, sir,
Wow.
150,000 new cases. And worldwide, it is estimated over 1 million cases occur, about 1,100,000 cases.
That's a lot. That's a lot. And what should people know about the colorectal cancer screening? What should they know about that screening?
Well, the most important thing, at least when I look at this being objective, is people have to know that colorectal cancer is preventable.
Okay.
It can be prevented. And there's several ways to try to go there. And we can discuss that a little bit later. So that's the most important thing. The second is if you catch it early, it's going to be likely to be cured. Now, screening refers to evaluating individuals based only on age, not because they have any symptom or any sign of cancer.
Okay.
Or changes in, that they patients feel that they have changes in their bowel habits, or they have blood in the stools, which are common signs and symptoms of colorectal cancer. So screening refers to testing individuals just based on age. And what's really important to know now is that, in fact, 2 weeks ago, the government advisors came with a recommendation lowering the age for screening for colorectal cancer to 45.
Yeah, I
So
was going to ask you about the age.
yeah, so that means with that recommendation, it means that insurance companies should cover screening for colorectal cancer in asymptomatic individuals without patients having to pay a copay.
Okay.
What are the
Okay.
symptoms?
Hmm?
Symptoms of for you can you have symptoms prior to 45?
Oh, yeah.
What are those? What are those symptoms?
Oh yeah. The problem that we have is that, yeah, we use 45, but when we look what has happened for the last few years, we have seen an incidence of colon and rectal cancer increasing in younger individuals. So it is estimated by, for example, 2030, individuals from 20 to 35 years old, the incidence of colorectal cancer will increase by 90%.
Mm-hmm.
Now, that's alarming because,
Yes.
as I just mentioned, the screening is only up 45 years old. So what happens to these younger individuals?
Right.
Mm-hmm.
And that's where we have to know what happens with us, with our bodies. How has there been anything that has changed?
Mm-hmm.
And for example, if you are extremely tired, you may have anemia,
Mm-hmm.
secondary to a tumor bleeding silently. You may have change in your bowel habits, constipation, thin stools or blood in your stools. Those are some of the most common symptoms.
Okay. So I'm gonna
Yeah.
let the people know that's listening. The first thing he said is you need to pay attention to your body. When you have changes in your body, that's a sign that something may be different or something may be going on. So I'm giving the listeners pointers. If they're taking notes like I take notes, then that's something they need to have in their notes. When your body starts to change or things start to happen differently than what they normally happen, then that's a sign that maybe you should go get a physical, go get checked out. So, and that's just on any level, not just, the colorectal screening, but any level. So, Dr. Rodriguez, you can go ahead and finish what you were saying.
The other important thing that I must stress, as I said, that cancer is increasing in the younger individuals. We're seeing a rise in colorectal cancer incidence in people under 50. In fact, about 1 in 10 colorectal cancers are diagnosed in people under age 50.
Yeah, and that's what I was going to ask you. Out of the 152,000, how many of those were under the age of 45?
Well, on the age of 50 is about 1 in 10.
Okay.
The incidence up to 45, if I don't mistaken, is about 33 per 1,000. I can check that. No, 33. From 40 to 49 is 33.3 per 100,000.
Oh, wow.
And 40 to 45 is 19.4 cases per 100,000.
Okay.
That's
still a lot.
It's still a lot.
That's still a lot.
The most common age for diagnosis of colorectal cancer, the average age is about 67.
67.
But it can happen on younger individuals. And it's a point that we need to drive to everyone.
So today we're talking about health, and we're talking about health in business for business owners. And we were asking Dr. Rodriguez a series of questions, and in those questions, we got to the point where we talked about the colorectal cancer screening. We talked about the common symptoms. We talked about when people should start to be concerned about the symptoms. Now we're at the point as, okay, where we have symptoms, we know that there's a concern. How can someone get screened? And is there screening going on during the pandemic? So that's a two-part question for you, Dr. Rodriguez.
Sure. I'm going to answer the last question first.
Okay, perfect.
Okay. We shouldn't, and I including myself, but we should not put off screening during the pandemic, especially now that the vaccines are out and that we know a little bit more about what we were dealing with.
Mm-hmm.
Because what has happened is that the National Institute of Health, they have come out with a model stating that because of the pandemic and putting off screening for breast and colorectal cancer, this may turn out to increase the number of deaths by about 10,000 from breast and colorectal cancer. So that's the long answer to a short answer.
Okay, and then I think the question is not whether we should put it off during the pandemic. The question is it available for us to come and get a screening during the pandemic?
Oh, yeah, it is available. It is available. Perfect. And in fact, if you have any questions on that, MD Anderson provides a telephone, which is Ask MD Anderson, which is 1-877 MDA 6789.
Give us that number one more time.
1-877 MDA 6789.
Okay. All right. Perfect. And then the first part of that two-part question is, how can someone get screened?
Okay, there's different ways of being screened. Keep in mind that I want to say that screening is different from someone who has symptoms.
Okay.
So screening is a completely asymptomatic individual, and it's based on age.
Okay, perfect.
And the age these days is now 45 years old.
Okay.
So there are different ways to screen. Ideally, or at least the gold standard should be a colonoscopy.
Okay.
So what is a colonoscopy? It's a long tube with a camera that is introduced to the rectum and advanced to the colon, to the bowels, and it evaluates the lining of the bowels.
Mm-hmm.
If there are polyps, they can be removed, because most of the cancers arise from polyps, which are growth in the lining of the bowel. Okay. So if they are removed, the polyps that are called adenomas are the ones that in general are the ones that progress to cancer. Not all of the polyps progress, but it has been shown that if you remove polyps, you decrease the incidence of colorectal cancer and you improve survival. That has been shown.
Okay.
Now, to me, that's the gold standard, because you're looking at it at the bowel, and you can basically take samples. There are other ways to screen. For example, there's stool for testing the stool for blood, for occult blood.
Mm-hmm.
There's testing the stools for changes in some of the cells that are shed by cancer, molecular changes.
Mm-hmm.
That's the stool for DNA test, for example. Then other ways that can also be done is combining this, testing the stool for occult blood with sigmoidoscopy, which is shorter than the colonoscopy. It only sees the left side of the bowels.
Mm-hmm.
And the other one would be CT colonography, which is doing a CAT scan, which is a series of X-rays at the computer, synthesizes what they're seeing, and then looking at having someone, the radiologist, look at the bowel and see if there's any abnormalities that need to be then looked directly.
Mm-hmm.
So the whole important thing and the message from here is that it's not only colonoscopy, but there are other testing methods for screening.
I don't know who that is.
Now, The key is that if any of those methods for screening is positive, you will need a colonoscopy. So potentially is why not start with a colonoscopy and what it's there, and that's the rationale for me, biasing myself on colonoscopies.
Dr. Rodriguez, I'm listening and I didn't hear anything relative to hemorrhoids. Is hemorrhoids also something that individuals should be concerned in terms of getting screened?
Well,
I've heard the polyps, but I didn't hear hemorrhoids.
Hemorrhoids have nothing to do in terms of being a risk factor for cancer.
Okay.
Having said that, hemorrhoids can bleed, and we see patients that have been bleeding for quite a while, and it has been attributed to hemorrhoids. And the bottom line is that if you have any kind of bleeding, you should be examined and don't assume that it's hemorrhoids. You got to prove that is not that there's nothing else causing the bleeding.
Okay.
And so just to make it clear, the most common screening is a colonoscopy. Am I correct in that assumption?
Yeah, I would say yes. I would say yes. The most common screening is colonoscopies. Okay. Now it depends. Again, it all depends on where you are and what is available. Mm-hmm. It depends on the resources out in the community where the individuals are.
Okay. And then I guess the next question is, what can people do to reduce their risk of colorectal cancer?
Well, colorectal cancer, it's quite interesting because it appears to be related to more developed countries.
Okay.
Okay. And with that, we start looking at multiple factors. Diet.
Okay.
We love meat. We love all those processed meats like hot dogs.
We are carnivorous beings.
Burgers, Spanish ham, all those things. We love that. So we got to start eating less of that.
Okay.
Lack of exercise. We basically don't do enough exercise. We lack physical activity. We're overweight. Mm-hmm. Obesity is another factor. And obviously the genetic makeup, whatever we have in our genes, because colorectal cancer, there's some individuals that are predisposed to colorectal cancer because of the genes also.
He's already talked about, I think, the FIT test, but MD Anderson has a program with community clinics where people can go in and get a FIT test, and if there's blood found in that test, they can come to MD, they can get a free colonoscopy. Okay. So, but I do want to emphasize that, and like you just said, with people who have people that have colorectal cancer in their family, particularly a parent or a sibling, they are at increased risk. So you would want to get screened earlier.
So if a family member has had colorectal cancer, then it's something that you, one, need to be aware of, and two, need to make sure that you get screened for.
Yeah, the other important point with that is that colorectal cancer is not only colorectal cancer, because other cancers can be associated with whole or colorectal cancer, especially with inherited syndromes. But if you have a family member who's your brother or sister, your parents or your children who has had colorectal cancer, your risk of developing colorectal cancer is twice that if no one else in the family had colorectal cancer. And that risk even increases if that individual who was affected was less than age 50.
Okay. So if they were younger than 50, then that, it affects it even more.
It increases the risk of developing colorectal cancer in that.
Okay.
Those individuals.
Okay. And then Ms. Jeanette was talking about the FIT test. And what is some of the research and development for colorectal cancer that's going on right now?
Well, I think one of the important research is looking at the molecular changes that occur in the tumor,
Mm-hmm.
trying to tailor, when you're treating the patients, tailor the treatments to the molecular changes.
Okay. Yeah, because everybody's body is different. Yeah. So, okay. All right.
The other important thing is using immunotherapy uh,
Mm-hmm.
for cancer. There's some of the colorectal tumor types that may respond to immunotherapy, especially one of the inherited syndromes do that, and tumors with that, and so also trying to develop vaccines
Mm-hmm.
from the molecular changes also.
Okay. So vaccines. Um, Mr. Strap. Mr. Strap.
I
Yes.
got it right. I got
It's
it right.
Jeanette.
Lastrap.
Yes.
Miss Jeanette. So tell us what you do again, Miss Jeanette.
So at MD Anderson, I work in the community relations and education team. And what we do is we go, well, pre COVID, we were all in and around the Houston community. We go out and do presentations, cancer prevention presentations to all kind of groups, students, sororities, fraternities, churches. All of our presentations are free to the public. Now that we are in the age of COVID, we turn to virtual.
Mhm.
So all of our programs and events are virtual now. Um, but again, pre-COVID, we go to exhibits, health fairs, and we also have print materials that are free to the public. So if a person wants to go on the website to learn more about the programs, they can go to our website at www.mdanderson.org/community.
Okay.
And
And
so,
that.
as I said, we have plenty of presentations, breast cancer, skin cancer, presentations on how to, as Dr. Rodriguez said, unfortunately, being obese and not maintaining a healthy weight increases your risk for some cancers. And so, we have programs on how to maintain healthy weights and how
Mhm.
to eat healthy portions, exercise, and things like that. And we also have a puppet show and a team presentation for youth because tobacco causes a lot of cancers, and so we also want to start kids as they're young and talk, educate them on the dangers of all types of tobacco. So
Mhm.
The other thing is alcohol also
Hmm.
affects the lifestyle.
yes,
Okay. All right. Ms. Jeanette, I heard you talking about the community resources. Are there any additional community resources that are related to the colorectal cancer,
yes.
outside of, maybe what's outside of the website that you gave us?
Yes, so if a person has a question on screening, of course, they want to talk to their physician. So if they're having some sort of, they're like, hey, I'm 45 or my cousin had colorectal cancer, should I get screened? Then, of course, talk to your physician or your healthcare provider on screening. But a person can dial 211 to get screening resources close to them if they don't have insurance or if they have a low income and they're concerned about that. Again, MD Anderson does have a program, the FIT program, where we work with federally qualified health centers
Hmm.
to do the FIT program. The FIT test can be done in the comfort of their home, but again, if there is blood found in that test, then they can get a free colonoscopy.
Okay. Okay.
I, I,
Perfect.
I just want to, so because we talk about the FIT program, but the FIT program is a sample of the bowel movement put
Hmm.
in a little card
Hmm.
that looks for human hemoglobin, for human blood, and that's
Okay.
how it's detected.
Okay. All right. Yeah, that's good information to know because I thought it was like, like something simple like you just I, I had no idea what it was. I didn't know it was the
No,
whole.
you're talking complicated. This was
Yeah,
this was simple.
it was very simple. I thought, they just said the fit program. I was like, oh, okay, you got to do some workouts and stuff. And
You were
they
thinking
all
of
these,
exercising, huh?
yeah. Miss Jeanette, what other education programs are available to the community?
As I stated earlier, we have a lot of presentations on how to reduce your risk for cancer. So we
Okay.
have a tobacco specific presentation, we have breast cancer presentations, we have skin cancer, and then we have other presentations other than that, but we have a main 9 ways presentation, which it goes through the 9 different ways we want to talk to people on how they can reduce their cancer risk. So that's the overall general presentation.
Mhm.
But again, if you go on our website, the one I gave you with the community at the end, you can
Yeah.
see a list of all of the different presentations that we have. And I want to also say that our presentations are not only in English, but we have them in Spanish and Vietnamese as well. The majority of our presentations. So we do
Okay.
have health educators that can speak Spanish and Vietnamese, and so as I said, we go out and do presentations all over. And we have a colorectal presentation as well. Dr. Rodriguez did great today. And I just want to say that in the presentations that I've done in the community, especially with a certain demographic, they're like, oh, I don't want to, go do that. But let me just also state that the colonoscopy test itself is not bad. I think the part that people have issue with is the prep because you're kind of sedated when you do the colonoscopy, so you really don't even know what's going on. But it's the
Hmm.
prep that's probably uncomfortable, right?
Yeah.
That's the thing. But if you do the colonoscopy and if everything is okay, chances are the doctor may say we don't have to see you for another 10 years, so you won't have to
Yeah.
do that prep for another 10 years. So
Mhm.
that's why the colonoscopy, aside from also preventing cancer by taking away polyps, that's why it's the gold standard. So
Well, I'm saying that the real takeaway, as you mentioned, Jeanette, is there's things that you want to be able to do and things you want to be able to complete in life. So the key is go ahead on and take care of what you need to take care of now
yes,
and keep moving forward. So we have to get our community and those individuals in that community to understand if you're doing business, you want to be around. And if
yes,
there's early detection, then you can be around a little
right,
longer. Excuse me. And so I think what we want to do is remove the fear of something, to where this is, I believe this is one of the reasons where people do not want to go through the prep. They want to go through because it's the fear of what is unknown. And I think these types of community educational programs and outreach and letting people know there's nothing to really fear. What you're doing is you're taking control
right,
of your
right.
life
Mm-hmm.
and what you want to be able to do next.
Yes,
So we appreciate the opportunity that we've been given today to at least share this with our constituents who are business owners. And of course, business owners have family members,
right,
and their customers are also individuals. And so if we can work together to eliminate that fear of the unknown, because what we can do is we can say, now we're going after knowing, and in
right,
knowing there are things that we can do.
right.
So we do appreciate you being here today, and even with our technical difficulties. But I'm going to ask, starting with Dr. Rodriguez, is there anything that you would like to share, any experience, any information that you believe will be helpful to our listening owners who are listening viewers rather,
Yeah.
who are usually going to be business owners, who do have families. And then, Jeanette, if there's anything that you would like to add before we close out our podcast this morning?
Well, the first thing is I'd like to thank both of you and the listeners for their attention. And we're here at MD Anderson. If there's any questions or anything, uh, uh, they can contact the website and get a hold of us. The second thing, if there's anything that we can get out of this interaction this morning, is that colorectal cancer is preventable, and if you can detect it early, it should be cured.
Good.
So it is an ounce of prevention. And it's not only for the business owners, their families, but it's also for the employees. It's for everyone in the community.
Yes.
And it's so important that we forget about the discomfort of the bowel prep and we just move forward and let's do this. Let's look into it because we can prevent it.
Yes, sir. Let's get it done. Right? Get her done.
Yeah. Yeah.
And I'd like to reiterate the same thing Dr. Rodriguez said as well. I know as business owners, everyone, is busy, but again, for your family, for your health, and to be able to have that longevity in life, you want to make sure that you get screened and to take care of your body. So just remember that. And again, I know it's hard sometimes, parents, business owners, but you have to take time for yourself and make sure you get checked.
Excellent.
Yeah, well, here at Tri-County, we are committed to acquiring and disseminating valuable business information, resources, and tools for member firms to achieve entrepreneurial parity and economic prosperity in the region and internationally. And what we did today was disseminate some valuable information to business owners. You guys, if like Ms. Thompson said, I can't say it enough. If you're in business, you want to be around. If you're not around, then you're not in business. So
Right.
it's clearly stated, and with the colon cancer, they were being politically correct and saying that they don't like the prep. Well, for most times when guys are talking about it, they don't want something going into their rectum. So that's a lot of the stigma behind it.
Yep.
But like she said, she thanked you guys for being here, and I'm thanking you guys again. This was our Let's Talk Business podcast, May the 28th, 2021, University of Texas MD Anderson Cancer Center. Thank you guys. Have a great weekend. Have a great holiday.
So much. You too.
All right.
Yeah.
All
Thanks.
right. Bye bye.
Bye bye.
All right.